Hi, Francisca here on Related Health Matters. Now, today I've chosen to talk about autoimmune disorders. And according to the American Autoimmune Related Diseases Association, about 50 million Americans have an autoimmune disorder. Individuals may and often do have more than one autoimmune disease. Now, personally, I do know people affected by this condition, and chances are you do. Let's appreciate the dynamics around this disorder. And so let's talk about autoimmune disorders. Our body serves different functions. There's the function of digestion, enabled by the digestive system. There's a function of transport of materials within the body, enabled by the circulatory system. There's also the immune function. Now, by virtue of our interaction with our environment, our body gets exposed to different elements within the environment. When foreign agents enter the body, the defense system sets in with the aim to curb the impact of the foreign or harmful agent. Simply put, our immunity is the protection conferred upon the body against diseases caused by bacteria, fungal, viruses, parasites, or other toxins. What is the immunity? The defense system of the body. It consists of a network of chemicals, cells, tissues, and organs of the body. And what are the constituents? These are the skin, the first line of the defense. There's the thymus, there's the lymph nodes, lymphatic system, the spleen. Now, in these areas, there are specialized cells broadly categorized as white blood cells. Here, they produce, they mature, and acquire functions that enable them mount attack against these foreign agents when they get into the body. Now, like other physiological system of the body, the immune system is prone to disorders, and hence we're going to be talking about these disorders, including the autoimmune disorders. Let's talk about these. Now, before I talk about the immune disorders, let's understand two key concepts here. The first is the concept of the antigen. Recall, when the body is exposed to a foreign agent, the defense system triggers an immune response. So, that foreign agent capable of triggering this immune response is called an antigen. Then there's the concept of the antibody. Now, the antibody is a special kind of white blood cell that is produced to counteract the effect of this antigen. What you need to know about the antibody is the antibodies are specific to any kind of antigen they counteract. So let's explain now the disorders of the immune system. Now we have immunological disorders. I will identify three main categories under these disorders. The first is the hypersensitivity reactions. Now, under the hypersensitivity reactions, there are subcategories. The differences among these subcategories are subtle. However, in general, there's an exaggerated response of the immune system to the presence of an antigen. And so under here we have examples like the allergies, the various food allergies we have, the drug allergies, allergies to pollen dust, there's the anaphylactic reaction, there's contact dermatitis. So in all these examples, there's an exaggerated response of the immune system to the presence of an antigen. And there's a second category, the immunodeficiency disorder. Here, it could be innate or acquired. Now, in these cases, there is either a deficiency of a specialized group of cell or group of cells that are part of the immune system. For innate, the person is born with that deficiency or total absence of a special group of cells. An example of this will be the severe combined immunodeficiency, also called the bubble boy syndrome. You see, years back, in Texas, there was this boy who lived in a plastic bottle for 12 years just to protect himself against the external germs. And so it was nicknamed Bubble Boy Syndrome after him. It's actually called the severe combined immunodeficiency. And there are the examples. For the acquired, the very popular one is the acquired immune deficiency syndrome, AIDS. There's also cancers of the of the cells, the immune cells, like or white blood cells, like leukemia. There's multiple myeloma. So these are examples of immunodeficiency disorders. And then you have the third category, the autoimmune disorders. Now recognize every cell in the body has attached to it a marker. This marker called Major Histocompatibility Complex MHCs help to identify the class of which that cell belongs to and also help to identify that cell as belonging to self, that's the body. The cells of the immune system are able to recognize the MHCs as belonging that are attached to this the various cells, and so there's no response or triggered immune reaction to the presence of cells, right? In the presence of the foreign particle, on the other hand, they do not recognize the presence of these markers, and hence they attach to these markers, stimulating a cascade of events that eventually cause the production of antibodies. And these antibodies eventually attach to the antigen and destroy these antigens. And so, in autoimmune conditions, the body fails to recognize the self cells from the invader cells or the antigen. And so this cascade is triggered, whereby antibodies are eventually produced, which now mount onto self cells and cause destruction. And so this is the pathogenesis or the process of diseases that cause autoimmune disorders. So let's give examples of these disorders. Now, it is known there are well over 100 cases of autoimmune disorders worldwide. And here in the US, the typical examples will include Hashimoto's thyroiditis, Graves' disease, rheumatoid arthritis, vitiligo, type 1 diabetes, systemic lupus erythematosus, pernicious anemia, multiple sclerosis, myositis, Sjogren's disease. The list goes on. Now, the causes of these disorders are unknown. However, hypotheses suggest factors such as environmental, hormonal, or even genetics do play a role. Now, it is said to be a disorder affecting women more than it does affect men. However, this doesn't follow the norm in all cases. For instance, Goodpasture syndrome is known to be a disorder of young males, and also the manifestations vary. There are some autoimmune disorders that target tissues, specific tissues. There are some that are systemic in manifestations. Say, for instance, systemic lupus erythematosus. This is a systemic disorder, simultaneously affecting systems such as the skin, with manifestations such as rash, skin rash, like the Miller rash or discoid rash. There are oral ulcers. There is the effect on the joints. So you have polyarthralgia affecting multiple joints, pain involving multiple joints. There is the gastrointestinal tract involvement, renal or kidney manifestations. There's manifestations involving the CNS, the central nervous system, such as stroke or psychosis, even depression. On the other hand, there is Sjogren's syndrome, which specifically targets exocrine glands. And so you have manifestations such as dry mouth or dry eyes. So let's talk about the treatment of autoimmune disorders. In talking about the treatment of autoimmune conditions, the aim here is to alleviate the symptoms and the prevention of further manifestations, and not necessarily to address the causes. And so there are certain principles that apply in the treatment of autoimmune conditions. The first is with the alleviation of symptoms. And so, for instance, if the problem is with an organ producing certain hormones, then when possible, there is the need to administer that hormone. Example is in type 1 diabetes. There is the administration of insulin. A second principle is in addressing the inflammatory component. And so there's the use of steroids such as prednisone. Now, prednisone can be used as a bridge to curb the flare-ups. It could be used long term, right? If, however, used long term, and there are times this is necessary, and there's a need to stop on using the medicine. Remember, there's a gradual taper off of dosing of prednisone. The third component is in use of immunosuppressive agents, and these address the proliferation of cells of the immune system. Example of drugs in this category will be drugs like cyclophosphamide, chlorambucil, methotrexate. And then finally, there is the administering of agents that block what we call tumor necrotic factor, TNF. The TNF pretty much sets in the inflammatory processes, and it's been found that drugs that block these agents uh, actually help in alleviating symptoms um, drastically. And so, examples of medicines or drugs in this category include adalimumab, popularly called Humira. There is etanercept, popularly called Enbrel, brand name that is. And so these are the principles of treatment of autoimmune conditions. Now, can we prevent these autoimmune conditions? Let's talk about that. Unfortunately, as the causes remain unknown, little can be said about the prevention of these conditions. Now, apart from the role of medicines as discussed, there is much that can be said about supportive therapy. Now, the nature of this illness is chronic, and so apart from physical impact, there is the financial, social, and mental toll on persons affected by these conditions. And so there's a need for deep understanding and empathy towards those affected by these conditions. And support could be just by reiterating your understanding of the condition. It could be by showing emotional support, showing or giving encouraging words, helping out, whatever that means to you. It might mean you helping a friend, a patient, to a scheduled visit to see their care provider, their healthcare provider. Remember, during flare ups, some of these patients experience intense pain. Now, the world of medicine is never stagnant, there's continuous research. And so perhaps one day, there might just be the uh, knowledge, the full knowledge about the causes, the cure, and prevention of autoimmune disorders. And so we, on the other hand, continue to encourage one another. Let's continue to put up the fight against autoimmune conditions. As always, I hope you did find this topic informative, educative. And if you've had, I would like you to subscribe, and I'll see you in the next one.